You're watching Good Day Central Illinois on WYZZ.
Well, as the cold months start to roll in, some can find themselves stressed out and struggling with symptoms of depression. So this morning, we have Dr. Brian Curtis here with us today to discuss the holiday season, the emotional toll it can have on us, and what we could do to cope with those feelings. So good morning, Dr. Curtis.
Good morning.
Thank you for being here.
Thank you.
I know you're probably, it's a little bit of a change
This is
here
different,
today.
I know.
Yeah.
Someplace to take a nap in between scenes, right?
I will say, it is good for that.
Yeah.
But we want to talk about how people should respond to their feelings over the holiday season. I know it can't be easy.
Yeah, so this is a really tough time of year, right? But it's also joyous. And I think the big thing is to actually acknowledge those feelings. And so if it's okay to be sad and it's okay to be upset and just acknowledging that. And if you are, reach out to somebody, talk to them. But the biggest point is just acknowledging your feelings.
So going off of that, you talked about being able to talk to other people. Why are those support systems so important?
Yeah, I mean, a lot of people have lost loved ones during this time of year, and so it's just kind of, it's kind of that mixed message, right? You're supposed to be happy, but you're kind of sad, and so really developing that support network is going to help carry you through that, and really kind of reaching out to people, and then actually for the people to reach out to somebody else. And so, somebody's going to have a tough time during this time of year, don't wait for them to call you. Reach out to them, check on them, see how they're doing.
Well, it's also, there is an unfortunate reality with some people that don't have close family or close friends to talk to. So what is the next step when it comes to that?
Yeah, I mean, there's a lot of support groups around depending upon what your issue is. If you lost a loved one, somebody to suicide. I mean, so there's a lot of support groups out there that you can reach out to. Always there's your healthcare professional that you can reach out to also. Utilize them. They can connect you in with support groups or actually refer you into somebody to talk to.
Another thing that, although the holidays is a great time, there's a financial burden that comes with it. And I know that that can be a big stress for people, myself included. So what do we do when it comes to that?
Yeah, I think the biggest thing is setting a budget, both for food and gifts. And then being aware that, don't exceed it. And that's how you're going to meet it. And so you don't have to get everybody a lavish gift. I mean, sometimes the heartfelt ones is a letter or a card with some heartfelt message. But really the big thing is setting that budget and really sticking to that budget.
I have yet to do that.
Yes, it's tough.
It is tough. But we also want some ways to decompress, again, whether that be with family or friends or without them.
Yeah, and I think the big thing is we always talk about the me time, so this is a busy time, your holiday parties, and you're kind of just on and on and on and on. So you start scheduling all these things, but the thing you don't schedule is kind of time for yourself. And so really to kind of every day to schedule some time for yourself, 15, 20 minutes, no interruptions, no phone, just kind of some quiet time for you. And the other thing is to make sure you're scheduling time to maintain your healthy habits. And so these will fall off. So if you exercise, that tends to be the first thing that goes.
So then I guess going through that transition, that phase, when is the time to really seek professional help?
I think if you're really struggling, right? And so if you just are really kind of down and really just can't get out of that rut, that is a time when you definitely need to reach out. And just realize that, as a physician, I'm here for my patients. And so if you reach out to me, I need to hear from you. I want to hear from you. And the other physicians and APPs will feel the same. And so really, if you're just feeling really down and you just can't break that cycle, reach out and we're here for you.
Yeah, there's always definitely people that you can talk to. So
yes.
do that. That's what's going to help. But thank you so much for joining us this morning, Dr. Curtis, of course. And as always, we'll share these details on our website. That is ciproud.com.